hand, foot and mouth disease rising. Parents should know the signs. Every parent worries about the infectious childhood illness that sweep through classrooms. Most kids get their inoculations to avoid diseases like mumps and rubella that used to affect huge swathes of children every year. There's now an annual flu shot for tackling one of the winter's most contagious illnesses. Still, some diseases are proving harder to tackle than others. One of the most resistant is hand, foot and mouth disease, which still affects about 200,000 Americans in the USA every year. It could be a record-breaking year for the disease, which is already causing outbreaks among school kids and college students. Hand, foot and mouth disease, or HFMD, is an incredibly common ailment that affects hundreds of thousands of people every single year. It's highly contagious, and can spread easily from contact with saliva or mucus. In other words, you can get it from a sneeze, a kiss, or a handshake. It also spread quickly on college campuses, where food and drinks are shared frequently, and students tend to be overtired and not at peak physical health. Senior citizens or folks with weakened immune systems are also vulnerable, especially if they live communally, like in a nursing home. Even a perfectly healthy adult in the prime of life can get his disease. It all depends on what germs you're exposed to. The symptoms are unpleasant, but usually mild and not life-threatening. They include flu-like symptoms, like fever and sore throat. But HFMD is most characterized by the itchy red spots that appear on hands, feet, and mouth. Sores may sometimes also appear on the legs and genitals. The virus looks alarming, especially if you're sporting spots. It usually clears up on its own within a week or two. Because it's so contagious, this illness usually requires you to stay home until the virus is fully out of your system. Keep it from spreading to other folks in your community. If you happen to live in an area affected by HFMD outbreak, it's important to be extremely vigilant about hygiene practices. To keep this illness away from your family, make sure everyone is washing their hands after leaving the bathroom, and before touching any food. If you suspect HFMD, make sure to keep your kids home from school until they have been cleared by a doctor. The best treatment is rest and plenty of fluids, even if the sores make swallowing a little painful. Help to prevent the spread of disease this year. Thank you.